I think the biggest difference that we're seeing in terms of high cost sharing for Medicare beneficiaries is that under Medicare Part D there is a lot of co-insurance, which is where they're responsible for a percentage of the drug cost as opposed to a flat co-payment. And that type of payment structure hasn't really stretched to other forms of insurance yet. So we are seeing Part D beneficiaries being responsible for much more of the cost than we see in other forms of insurance. Unfortunately, we see a lot of people either walking away from the pharmacy counter or trying to find other ways of getting their prescription drugs, which is the problem because obviously they're operating outside of the system or they're not treating the conditions that need to be treated, and that can ultimately lead to higher healthcare costs down the road. I think both of them are being negatively affected. Innovation is great, but it's only great if you can afford to use it, and unfortunately that's kind of the trade-off that we're facing right now. And we want to be sure that people have access to these innovative therapies. The Medicare program is a taxpayer-funded program, and the more it's spending on these types of products, the more taxpayers are spending on these types of products, the more beneficiaries are being asked to spend on these types of products. And unfortunately, I think a lot of outside groups, MedPAC included, have come to the conclusion that it's really unsustainable. And again, that pushes us to kind of a precipice where people can't access the drugs that they need.